Fill your thirst beside the river. Wash the journey from your hands. Feel the comfort flow inside you. Come this far, you understand.
Hi.
Hello.
Welcome to Healing Outside the Box. This is our 174th show. And the title of the show is The Great Massive Vaccine Cover-Up. And I am your host, and my name is Rosemary Lachance, and I'm an energy healer and a spiritual therapist.
Hi, and I'm your co-host. My name is Dina Scungio, and I'm a student and a teacher of spirituality.
And we are the co-hosts for this thought-provoking series and are dedicated to providing you with food for thought information and answers to all modalities of alternative healing, spiritual development, animal welfare, environmental concerns, and so much more in the form of guest speakers who are experts in their field.
And to find out what shows are playing in your area and when they are playing, please contact the public service channel in your town. To find out their website, please check Rosemary's website, where you'll find a list of all the towns that air this show under Healing Outside the Box. We will give you her and my website address at the end of the show. Please also go to Facebook and like our show on Facebook under Healing Outside the Box, where you can learn about the show and see pictures of our past guests and ask questions or leave a comment. And please enjoy the show.
Okay, tonight we have with us Susan Lee, who is an attorney in private practice and advocates for vaccine-injured children, adults, and their families. She's the founder of Know Your Vaccines, LLC, and a member of the Vaccine Injured Petitioners Bar Association and American Association for Justice. Welcome, Susan. Welcome.
Thank you.
We have also Dr. James Sensenig, Naturopathic Doctor here in Hampton. And Dr. Sensenig has been practicing naturopathic medicine for nearly 30 years and is well known for helping thousands of people regain their health. Dr. Sensenig sees patients with complaints of all kinds and is particularly interested in the treatment of digestive diseases, headaches and migraines, joint and muscle complaints, chronic fatigue. He also sees children with health problems ranging from asthma and eczema to developmental delays and autism. Dr. Sensenig graduated from the National College of Naturopathic Medicine in Portland, Oregon, where he later served as Dean of Education. He was the founding president of the American Association for Naturopathic Physicians, the chairman of its Government Affairs Committee for a decade, and the founding dean of the College of Naturopathic Medicine at the University of Bridgeport, Connecticut. Dr. Sensenig has consulted for a number of government agencies, insurance companies, colleges, and natural products companies. He's on the faculty of the Southwest College of Naturopathic Medicine in Tempe, Arizona, and the University of Bridgeport College of Naturopathic Medicine. And with us tonight on the air, she won't be able to be here, but because she is from Montana, is Norma Erickson. Do you want to read about Norma?
She's joining us by phone tonight. She's the president of SaneVax Incorporated. She was an average citizen working as an independent business consultant and freelance author before she became aware of the number of people experiencing debilitating medical conditions after direct response to the worldwide after the administration of Gardasil or SaneVax. In 2010, she established SaneVax as a direct response to the worldwide devastation left in the wake of the HPV vaccination programs. The SaneVax team believes no vaccine should be approved for public use without first being scientifically proven safe, affordable, necessary, and effective. At no time from concept through administration have HPV vaccines met any of these common sense criteria. Therefore, she and the SaneVax team have made it their mission to create a world where only scientifically proven sane vaccines and vaccination practices are allowed.
Are you with us, Norma?
Yes, I am. Hello.
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 I hope they can hear her on the air. It's okay, loud enough? All righty. Well, welcome to Healing Outside the Box.
Thank you for having me.
All right, first, before we start, I'm going to say this one little paragraph about the human, how do you say that?
Papilloma
Papilloma.
virus.
Papillomavirus vaccination. More American states are mandating the HPV vaccine for teenagers. Are these mandates necessary and helpful in protecting against cancer? There is growing concern from other countries about this vaccine's activity and efficiency. Let's examine the scientific and legislative issues with this vaccine in America and other countries. How are other countries reacting to this vaccine? Okay, so we'll start with you, Dr. Sensenig. What is the human
Papillomavirus. Well, it's one of many viruses. There are probably over 100 or more strains or types of HPV virus. About 30 of them or so may cause problems with changes in the cervix and or cause warts. And are transmitted sexually. And so those are the viruses we're usually talking about with HPV.
Okay. Norma, how was the HPV vaccine approved in the United States?
The HPV vaccine was given the fast track designation, which basically means that the manufacturers were allowed to bypass most of the safety precautions and testings that they would have had to have run had they done a regular vaccine type approval. It did not qualify for fast track designation when it was awarded. In order to get that, you're supposed to be combating a disease for which there is a serious health issue in the United States, or a disease for which there is no current treatment protocol that works. Neither of those fit.
All right, Susan, what is the vaccine adverse event reporting system?
It's often referred to as VARS or VAERS, and it's run by the CDC, the Centers for Disease Control and Prevention, and anyone can report a vaccine reaction into the system. You can find it online if you Google or get on the website CDC Wonder, and it's a passive surveillance system. So what that means is, like I said, anyone can report an adverse event. Healthcare professionals are mandated to report. They have a duty to report a vaccine reaction. However, there is no penalty for failure to do so. So the FDA had done a study and concluded that less than 10% of serious reactions are reported.
Oh, wow. That's terrible. That is really
So
terrible.
think about that for a second, though. We're requiring healthcare professionals to report adverse reactions, in this case the vaccines, right? So that people know what's going on, so the medical community knows what's going on, so the public knows what's going on by having a database for this information. And yet, as Susan just said, it's estimated that only 10% of those adverse reactions are ever reported. So you might ask yourself, what good is a database with that kind of with that kind of participation, or maybe I should say lack of a participation? So when it's said that, well, there's no evidence that this particular vaccine causes this or that, if there's nobody reporting to the database, how can you say that?
Gee, I wonder why that is,
Because
though, you know?
because the reactions are, let's say, kept quiet or private, or I don't want to assign any necessary, what should I say, make it sound like it's not being done purposefully, but it's not being done. So where's the information?
Well, you leave it up to people's imaginations. I mean, 1 and 1 is 2. If you have anything going up here, what you just said would be a good reason. It would be a good reason.
In my profession as a physician, I cannot tell you how many times I have encountered a youngster who had a severe reaction to, now I guess I couldn't say that, I would say after they had an immunization to something, right? Their leg swells up to the size of a watermelon, or they develop a fever and seizures. And I have now this is anecdotal, of course, but I know of cases where the parent will report that immediately to the pediatrician. This happened in the car on the way home, and they're told it has no relationship. That was going to happen anyway, or it was a coincidence, or he caught a cold. Now, either way, the healthcare professional who just got that information, if he's denying a relationship to the parent between those two events, he's certainly not reporting it
No,
as an adverse event,
no.
whether he believes it or not. Right?
And it's certainly not in the medical record, which is important if a person pursues to file a claim for
never thought about
vaccine
that.
injury compensation.
Exactly. They cover everything, right? And I'm being polite.
And that website is cdcwonder.gov. That's a government site that they can look at.
Yes, they can look it up, and there's actually a tutorial. It's wonder.cdc.gov and then /VAERS.html. And for all the deficiencies, there is data on there, and you can search by vaccine, you can search by, serious event, and definitely for the human papillomavirus vaccine. I mean, the data is really shocking, as Norma has really looked into.
A simple way to remember the website here, instead of all that perhaps, is if you just remember VAERS, Vaccine Adverse Events Reporting System, VAERS. You just go to CDC and type in VAERS and you've got it. And
Okay,
it'll lead you to the
Well, I'm a
to
big
the
proponent on making people go and find the information for themselves instead
Right.
of just listening, because sometimes it goes in one ear and out the other. And if they do the work, then maybe it'll sink in a little better.
And you can also, to our TV audience, you can also be able to get in touch with Susan or Dr. Sensenig or myself to get any of this information. And even Norma, she has some contact information also. So let me ask Dina, want to ask the second question?
For Dr. Sensenig,
Yeah,
yes.
the second one.
Does HPV infection always lead to cancer?
That's a really good question. The answer is no. HPV infection rarely leads to cancer. A very small number of people who are infected with HPV end up with cancer, and the number's something like less than 0.1%.
Oh.
What's interesting about HPV is that HPV, in reported cases, disappears by itself within a few months. 70%, 75% of cases disappear within a couple of months by themselves, and clearly 90% disappear or are cured, or whatever term you want to use, within 2 years.
Oh, so you can cure that. Okay.
Well, by itself. We're talking about so-called spontaneous remission. In other words, up to 90% of people who have reported HPV infections are cleared, or it clears itself within 2 years. Which now,
Without the vaccine.
without the vaccine, apparently without the person involved doing anything differently than what they've already done. It's just a spontaneous change. Now, if I put on my naturopathic physician hat, I would ask this question. If it's possible for the body to clear the virus spontaneously in 90% of cases, what's going on in that 90% of the population that's not happening in the other 10%? And that's easy enough to imagine. It has to do with lifestyle and nutrition and so on. There's lots, and I don't want to get too far afield here, but there's lots of research that shows that, like, vitamin D by itself is antiviral. Vitamin C has antiviral properties by itself. Selenium by itself. Zinc by itself. You put those all together in the appropriate amounts in a single person, it's easy enough to fight viruses. See, one of the problems here is in the conventional medical community, there's no treatment for viruses.
No.
But if you understand how to work with the body's immunity and its natural defenses, that's not a problem.
Norma?
Hence why I don't take the flu shot.
Well, here's a perfect example. I mean, if you can allow that 90% of people with this virus, which supposedly causes cancer in some cases, can disappear by itself, there's proof right there that the immune system can take care of the virus under some circumstances.
The second question for Norma?
Norma, is the HPV vaccine safe?
Oh, I'm sorry for laughing. I'm sorry. That really, really depends on your definition of safe. it's pretty obvious that the FDA and the CDC and all the international health authorities say it's an unqualified yes. The problem is Merck's own clinical trial data indicates that for every 100,000 users, we're going to be left with somewhere between 23 and 2,500 serious life-threatening events, and between 2,400 and 3,300 people experiencing new medical conditions that are indicative, potentially indicative, of systemic autoimmune disorders. Now, for those 80 or so autoimmune disorders that exist, there's no cure. So we're talking about a permanent, lifelong problem for 2.5% of the users minimum.
And Norma, you said that is from the data from Merck's own trials, right?
Yes, that's from Merck's own clinical trials. It's the data that they submitted to the FDA for approval of Gardasil 9, because for the Gardasil 9 clinical trials, they used the original Gardasil as the so-called placebo. It's control group, they said.
Right.
So Gardasil 9 is no less dangerous than Gardasil is.
And the FDC is saying here that the FDA is saying here that all vaccines used in the United States are required to go through extensive safety testing before they are even licensed by the FDA. That's what they're saying.
The clinical trials for Gardasil and Gardasil 9, because of the fast-track designation of Gardasil, they followed those girls for symptoms for 14 to 15 days. Beyond that time, their safety follow-up was self-reported report cards that the girls turned in if and when they felt anything was amiss that they connected to the vaccine administration. Now, how many people are going to connect aches and pains in your body 2 months down the road to a vaccine that you got 60 days ago? So,
You're right.
It's true.
no, to me, that's not safety testing.
And by the way, this is the most expensive vaccine on the market. And what a lot of people may not know is the government holds a patent to this vaccine.
Well, the government does.
Yes.
Yes, our government holds a patent, and in 2010, that patent was the top producing government-owned patent
So this is
in
a
the
huge,
United States.
right, it's a huge conflict of interest that should be disclosed for transparency.
Really.
Do you have the numbers, Norma, on what that?
There's a Dr. Suba in California that filed for a Freedom of Information to determine exactly what our government was making off of Gardasil, and they wrote him back a nice letter that was national security information. They will not disclose it.
National security, huh? Oh, my
So
God.
how does Gardasil tie into national security?
Yeah, right.
I guess that depends on what they're using the patent money for.
Oh, my goodness, goodness, goodness.
Which begs the question, now, see, here we are laughing about this, but you think about the magnitude of this problem and the obvious conflict of interest and the questions of safety. Why is there essentially a media blackout on this kind of information? You know, people who oppose the use of vaccinations of any kind or of whatever kind because they are concerned about the safety, about the potential damage that may occur to their child, or are concerned about the idea of it being forced upon them without their consent, have legitimate issues in a country where we think of ourselves as being free
Free, right.
and having an exchange of information and an open dialogue. And yet, when this is forced upon us in the way that we're talking about here, and the information regarding safety and money and so on is kept in the dark, you can't help you can't help being suspicious. And yet the people who raise these questions are called all kinds of vile names and sometimes have their life and safety on the line and so on and so forth, as if it's a done deal and anybody who questions it has some kind of nefarious concern, when in most cases they're just concerned about their personal safety or that of their child. And we have learned that we can't trust the government and we can't trust the medical profession at every turn because there have been so many problems in the past with things that were deemed to be safe and then in retrospect turned out not to be.
That's right.
And that's been the century of 20th century medicine's been full of examples of that.
And we
So-
can't trust Big Pharma. Have
But
to
even-
add that in there, too.
But even if we say we can't trust them, doesn't it ultimately come down to the individual being able and responsible to make their own decisions with informed consent? And to have informed consent, you have to have information. You
Right.
can't be informed without having the information. Lay it out there, tell us what's going on, tell us what the upside is, tell us what the downside is, and then let the consumer decide. Not the medical doctors, not the government. Who is it that decides who takes care of you and what kind of medicine you use in your life?
Now, is there any studies on the people that that this has adversely affected, whether or not they had any type of illness to begin with, or if they were completely normal people that developed problems from these shots, from this vaccine? Is there any kind of information
I
on
think
that?
Norma can answer that question.
Norma?
but-
Yeah, there are several case reports and case studies that have been done. There are several studies that have been published in peer-reviewed medical journals. The vast majority of the people that appear to be getting hit the hardest are the ones that were most fit, most athletic before
Really?
the Gardasil shots.
Wow.
And they
Oh,
can't
wow.
figure out why. It's something they've never seen. I can't tell you how many times I've heard a doctor say, "I've never seen anything like this before."
Wow.
It's quite the mystery.
So yet people,
Now there are some overweight girls that have been hit pretty hard, but the vast majority are the extremely athletic, like the Olympic swimmer in Australia. That she was competing for the Olympics. She had won every single swimming competition in her country for the last 2 years. Had 2 Gardasil injections, I believe, and was paralyzed for the next 2 years.
Oh, wow.
I had read about that, yeah. Right.
Wow.
Yeah, and stories like that go on and on. Marathon runners, hockey players, basketball players, cheerleaders, competition dancers. It's just unbelievable. It's the vast majority of severe injuries. Now, I can't say all of them because that's not true, but the vast majority that we have been exposed to were very, very fit and healthy before.
Wow. So, Susan, why is the global reaction to this vaccine not mirrored in this country?
well, I think like what Dr. Sensenig said, it's the information. There is a lot of activity that's happening globally about this vaccine's safety. There are a lot of concerns. Norma can speak to this. But I think in this country, this information is not filtering to the citizens.
No.
And if you think about it, the U.S. and New Zealand are one of the too few countries where they allow direct-to-consumer marketing by the pharmaceutical industry. So if you think about it, think of how many pharmaceutical ads you hear on television.
Yes.
So, you have to think, about our media. I mean, is it biased? Is it truly portraying what is out there? And you also have to think about perception, inflating or focusing instead of, trying to present an even view of events. So, Nora, you can speak about what's happening globally with this vaccine.
Absolutely. And I think this one is a little bit different from previous years because in prior history, the pharmaceutical manufacturers have been able to isolate and segregate countries where problems occurred. They've told the health officials in various countries that they're the only country with the problem, or their population is malnourished and that's why there's a problem. Or they give them all kinds of excuses, but they isolate that country. And that could not happen this time because, well, partially I have to say it was SaneVax that did it, because when we got into this battle, we realized just how entrenched the pharmaceutical industry was in the United States and that we were not going to get anywhere battling here as quickly as we needed to save these girls. So we networked with countries around the world, and we put them in touch with each other. When something happens in Denmark, the people in Japan know it. When something happens in India, the people in Colombia know it. Whatever. So they know that they're not isolated anymore, and that's giving journalists and reporters, news reporters in various countries a little more courage to stand up and say, this is happening, we need to fix it. Because, okay, for instance, in Colombia, they approved the HPV vaccine, administered the first vaccine in the school system without too many problems. When they administered the second dose, the weekend after the administration, 700 girls ended up hospitalized.
Oh, my God.
Wow.
Pharma was down there right away, knocking on doctors' doors, and I have this for a fact because I've got insiders there. One doctor told me that he reported an adverse reaction to Merck, and he had Merck with 2 armed guards on his doorstep at his clinic the next morning saying this was not an adverse reaction. And that's just one example. When the health ministry down there completed their study, helped by pharma, of course, their conclusion was, among other things, that the girls had too much exposure to playing with Ouija boards.
What?
Oh, my
I'm
goodness.
serious. But they, and they do that, but because Colombia was already connected with Spain and Mexico and Costa Rica and all the Central American and Spanish-speaking countries, it didn't float, and the parents are up in arms. They've protested in the street. They've burned tires in the street. Not that I recommend that, but they're not falling for it. They're fighting for their kids' lives, and they're standing together with people in other countries for a change.
Now, Merck is the manufacturer of the medication?
Merck manufactures Gardasil.
M-E-R-C-K, Merck?
GlaxoSmithKline manufactures Cervarix.
Okay.
Right. So this information that Norma just reported, I mean, it's not on your nightly news, but it is on social media.
Yeah.
It is out there if you know where to look.
It is. It is. A lot of things. That's one thing that's very good about that. It does get out there. So many things get out there, and so many people share. But what surprises me so much is people don't see for themselves. They don't ask for the information. What can happen? They look on the prescription. When you get the prescription, it says something on what the adverse reactions could be, and then some of them say could even cause death. And I say, you want me to take that? There's no way I'm going to take that. No way.
And she does.
I don't take
She
it.
won't
And in all
take
fairness
anything.
to American parents, we have been brainwashed. Vaccines are safe, effective,
Yes.
absolutely necessary, or we're going to have epidemics of all of these deadly diseases. And that has been drummed into our brains since, well, I'm over 60 years old, so I can say a long time.
Yes.
I had no idea there was a problem with any vaccine
I know. Me neither.
until I started writing stories about the Gardasil survivors.
Well, one thing I'd
It's
like
the
to
first time in my life I've questioned vaccines. And oh my gosh, what a rabbit hole that turned out to be.
Right? Right? I know.
Well,
battling
it's
big
interesting to Norma. It's interesting to me that there aren't too many people who are going down the rabbit hole to explore it. One of the things I've talked to others about, and we were actually talking about here before we came on the air, is you look at other things that are happening in the world, and I don't want to make light of any of them, and I don't want to be denigrating or dismissive, but you look at some of the shootings in the United States. You look at disasters that are small by comparison. You look at people who die in a plane crash or a train wreck that's all over the evening news. It's a big deal. We get all crazy in a way about gun control or weapons or terrorism where a few people are injured. And again, I'm not trying to be dismissive or denigrating or in any way minimize that kind of drama or trauma. But that's, to coin a phrase, small potatoes compared to the damage that's being done with some medications and some vaccines. And why don't we talk about that? Why isn't that on the evening news? Maybe it's just not dramatic enough or horrible enough or obvious enough or something.
Or it could have something to do with the fact that 75% of the media its advertising budget comes from pharmaceutical companies.
Right.
Mm-hmm.
Pharmaceutical,
Could have something to do with
agricultural.
that. Definitely could have. But people use their imaginations on that.
And another reason why I think people don't know about what the potential side effects for HPV vaccine can possibly be is this vaccine information sheet that is produced by the CDC. And under law, when you receive this vaccine or any vaccine, you're supposed to get this, what they call VIS, Vaccine Information Statement. And you can see that it's 2 pages. Whereas, for example, the vaccine manufacturer's package insert, this is the one for Gardasil, which is one of the HPV vaccines. And like Norma pointed out, it's produced by Merck, and they also have another one, Gardasil 9. But you'll see that this is, 28
pages?
28 pages.
28 pages.
And this is what you need to ask for. This is the direct warnings produced by the vaccine manufacturer Merck. And by law, it goes to the doctor. And the doctor acts as a learned intermediary and is supposed to take in your own specific health history and risks in determining whether this vaccine is suitable for you. And then the healthcare professional is supposed to pass on these warnings onto you. But that often doesn't happen. There is no liability if the healthcare professional does not give you those warnings, or in fact even administers the vaccine for the most part because of a law that was passed in 1986. So be sure you get this vaccine manufacturer's package insert. You can ask for the doctor from it, or you can find it, Google it online and get it, because it has the contraindications, it has the side effects, it has the information from the clinical trials.
28
The odd thing about those package inserts is they clearly state if you have a reaction to the first one, you should talk to your doctor about discontinuing the series. That's not happening. And the other thing is, if you're allergic to any of the ingredients, how many parents know what the ingredients are? How many doctors know what the ingredients are? So how do you know if you're allergic to them or not?
Right. But imagine, 28 pages. I mean,
Yes.
my goodness, 28 pages of side effects and possible things that could happen.
And you're clearly saying that the doctor, your doctor that's in charge of your health, has no liability to tell you information about that. And if something goes wrong with that, they have no liability if something goes wrong with you when they're giving you that medication. Then that's,
I think that's
a
a
law.
point. I think that's a point that may be missed, even though you both said it twice. Susan just mentioned the law that was passed in 1986, and that was a law, the National Childhood Vaccine
Injury
Compensation Law. And what that amounts to is that the manufacturers of vaccines, i.e. the pharmaceutical companies, and the people who administer it, medical doctors and other healthcare professionals, are immune from any prosecution for any damages that may allegedly result. So here we have a product that may even be unsafe, and is known to be unsafe, but the people who are making it and providing it to you have no liability whatsoever. So you go to your question, which is one I have often raised, which is if the provider has no liability, to what degree is he or she responsible for knowing what's in there? Because it does, in some ways it doesn't.
I think one thing might be added in here. Every state has a law about informed consent. They're not liable for the damages, but they may be liable under the informed consent rules.
Okay, so,
But then that's going to be the doctor's word against the patient, right?
Yes, it's going to be the doctor's word against the patient, and it's going to be extremely expensive for the patient to institute that lawsuit.
Right, because the doctor is going to say that it was administered with informed consent in his notes.
Well, usually when you're given this vaccine information statement, you have to sign it. And in fact, now there's a barcode so that they can track which edition the patient got. You know, things are moving electronically. They're tracking who got vaccines, and not only children. I mean, this is going to adults. So don't think that you're immune.
Who's tracking who's getting?
From what I understand, the government has got a national registry, a database, and collecting who is getting vaccinated and who is not.
why do they have that? To
Why
help people or what?
Why does the government need to know what
To increase
vaccines?
vaccine uptake.
There we go.
Okay.
We're talking over $5 billion in revenue for vaccines that the government and the big pharmacies are making over on vaccines, on the vaccine medications.
You know, I want to just throw in something, too, that most people aren't aware of versus, we just talked about the National Childhood Vaccine Injury Act.
Of 1986.
1986. As I understand it, that law was revisited, or a similar, another challenge was brought up involving that law in 2011 to the U.S. Supreme Court that resulted in the full immunity of the pharmaceutical companies from vaccine damage. And in the court's findings, they said that, and correct me, I'm going to have the attorney correct me if I'm wrong, but the word that was used is that vaccines are inherently unsafe, or
Unavoidably.
unavoidably unsafe.
Unsafe.
Unavoidably unsafe. This is the U.S. Supreme Court saying vaccines are unavoidably unsafe.
Right.
That's not me.
No?
That's not her. It's
Right.
not you. This
Right.
is the Supreme Court of the United States. They're unavoidably unsafe.
Right. This is the Brucewitz case, for those who want to know more. And it was a case involving a girl and the DTP vaccine, the diphtheria, tetanus, pertussis
Really?
vaccine. And that is why they have this legislation, the National Childhood Vaccine Injury Act of 1986. It was because of this problematic vaccine that was creating a lot of neurological impairment, seizures, death in children. And what was so interesting when you read about the history of that vaccine was, you know, the UK pulled that vaccine from its market, and the US took a lot longer. It took so long, in fact, another country, Japan, used the technology that came from the U.S. to create the acellular version of the vaccine, the one that is now on market and used, that has less side effects. However, now they're finding it's not as effective, so now they want to go back to the wholesale vaccine, you know, the one that caused a lot of the neurological impairment. So it's sort of this...
Yeah, so
Was there a high number in the amount of people that took it? Like if you're saying 100 people that were given to it, was there 90 people that were having the bad reactions?
If you look on VAERS, I mean, before the HPV vaccine, that vaccine stood out as having the most adverse reactions. And now, since that vaccine is really no longer given, it's given in third world countries, I understand, but you can't really see it. But with the HPV vaccine, I mean, you'll see the spike in the number of adverse events that are reported by this vaccine. And what can be argued with the Brucewitz case in 2011 is you can't bring a lawsuit for defective design, meaning, this HPV vaccine, if you wanted to bring a lawsuit and said, hey, you can create a safer vaccine, you can design it safer, you can't do that in this country.
But they were saying, you were just telling us that they created Japan created a safer one, but they're saying it's not as effective?
This is the DTaP. Now I was talking about the HPV vaccine. But yeah, the Japanese used our technology and created a safer vaccine. And they found out through discovery that the U.S. had the technology, had the information, had the know-how, and could have done it, but just didn't do so because of, you can guess, the money.
Oh, okay. I thought you're saying that it wasn't as effective. But I was going to say, they were thinking of going back to the original
No,
one?
I'm saying that.
Oh,
That's
they
going
are?
on now.
Yeah.
They're saying, children are getting pertussis. There's a rise in it. This vaccine is not as effective. In fact, there was a study. They found that in baboons that, you could be an asymptomatic carrier and actually spread pertussis without knowing. So then they're saying, let's go back to the wholesale, the DTP vaccine,
Right.
because it was more effective. But what people don't realize is, that was the vaccine that created all this liability protection for the vaccine manufacturers. I mean, you can't even sue the vaccine manufacturers if you want to get compensation for a vaccine injury in this company. You sue the Department of Health and Human Services, which is another conflict of interest because they're also the department that's regulating, approving, and recommending use of vaccines. So people need to understand
money from
that.
the patent.
Right, and
What'd you say?
getting
And
money from the patent.
They have it so intertwined with each other and so twisty and so whatever and so hidden, and that people, I don't even know how many people will really know what we're talking about here tonight because they don't investigate. It's like you said, it's all there on the web for them.
Right. This website that our attorney just mentioned was nvic.org, and that's the National Vaccine Information Center, where you can get a whole lot of information about a lot of things that she's discussing here. So
Wait,
go and do the information hunting yourself, and you'll also find out.
This is valuable information that we're giving you tonight, and if you don't take it and run with it and protect your children and protect your loved ones, I don't know what else to say. I really don't.
And what would you say to people who would say, would it be worse to get the disease than get the vaccine? What would be worse, the side effects and all the things that cause the vaccine? Because people seem to have it in their head that, well, if we lose a few but we save more, what's the harm? And I've heard a lot. I work in the medical field. I work as a paramedic. And I've heard a lot of people say things to me like that. Well, we give a drug called lidocaine, and we found out in one of our in-services that lidocaine actually hurts more than it helps. Well, then why are we giving it? Why are you telling me to give this to somebody if it's not helping? Well, because it helps this many people.
Well, the answer there is follow the money. That's the answer.
Well, exactly. And people
Okay.
don't want to hear that because, unfortunately, people, especially in the United States, I've found, and I've tried to talk to people about GMOs and things like that, and they don't want to hear it because that means that they actually have to go out and learn something for themselves and do the homework to protect themselves, which I don't understand, but they want to be told by media what to do and how to do it instead of doing it for themselves.
Well, let's go back to your question, though. Is it worse having the disease or having the risk of the side effects of the vaccination? It depends on which disease you're talking about.
Right.
In the conventional world, let's start there. There are many diseases which are of no consequence. When's the last time somebody died of mumps, measles, chicken pox? We all had it as kids and it was no big deal, right? So are there some deaths from mumps, measles, chicken pox? Yeah, maybe one here and there or something like that. I'm going to come back to that in just a second. Now, maybe there are some diseases that we ought to be really concerned about. Maybe. I'll talk to maybe in just a second. Maybe whooping cough is a problem. Maybe polio is a problem. Maybe tetanus is a problem. But those aren't the problems that they were years ago. And the vaccine, the argument on the vaccine side is that the vaccinations have decreased the prevalence of those diseases. Well, there's another side to that story. That's not my side or some kind of anti-vax thing. There's a whole there's a great deal of evidence that suggests that the reduction in infectious disease has little or nothing to do with vaccination and has everything to do with changes in sanitation and public health and clean water and so on and so forth. There's an interesting book around called Dissolving Illusions by Suzanne Humphreys, a medical doctor, I think in the UK, who became interested in this subject. She was a conventional practitioner who, like Norma has been described as a normal, uninterested person until she started looking into this, and then suddenly, she sees what's down that rabbit hole. Dr. Humphreys was an ER physician in London, I think, or somewhere in England, and she kept seeing more and more and more vaccine-damaged children coming into the ER, or I should say reactions. So she undertook to explore it, and she has written a very comprehensive book on this subject that suggests that the evidence that vaccines, which is what we're told in the United States and elsewhere, the evidence that vaccines have actually reduced the number of these incidences of infectious disease is, it's spurious at best. You can explain it a completely different way. So, is it necessary to do the vaccines when we have, again, clean water and public health measures and so on? The listener can decide for themselves. But there's a whole other way of understanding disease and treating disease, which has to do with supporting the body and its innate ability to correct problems, to heal itself, including robust support of the immune system, which will render one immune, I'm going to use that word, immune, to virtually any infectious disease. Germs don't cause disease. They cause disease in susceptible people. Right. And if you remove that susceptibility,
Right.
then you got a whole new ballgame.
There's something that people don't realize because they just discovered it scientifically last year, or when they did the microbiome mapping, they
Yes.
discovered that the average human body has 10,000 times more bacteria and viruses in their body than they do human cells. So these viruses, for the most part, are not a threat until they're unbalanced some way. And that's brand new scientific knowledge that's being completely ignored, except for by specific practitioners like Jim.
Yeah, I have to say, as a naturopathic doctor, that information has been known since Pasteur and Beauchamp brought this information out about germs 150 years ago. But their work was taken out of context by the now medical profession and the pharmaceutical industry. It's like, I just had a young man working with me in my office last week who, before being in naturopathic school, was in farming and animal husbandry. And he says, when you have a problem with the plants where they're some kind of an infestation, you don't go poisoning the soil and the plants to get rid of the infestation. You change the environment. Right? You improve the health of the soil and the crops in order to bring things into balance. But somehow when we have an imbalance in the human body, we come at it with chemicals to try to stop the imbalance. You can't poison people back to health. It doesn't work.
Right. Speaking of scientific discoveries, Norma, can you, there was a scientific discovery or allegation regarding the HPV vaccine, and you had, done enormous work about this. Is there something, can you talk about that?
Sure, I can. Initially, HPV vaccines were approved worldwide under the premise that there was no viral DNA in the finished product. None. We've got package inserts from all over the place saying exactly that. And Dr. Sensenig Lee discovered that there was indeed viral DNA fragments in the vaccine. It was due to some research because a girl in Canada's mother had called SaneVax and said that my daughter tested positive for HPV-16 in her blood 2 years after she was injected with Gardasil. Now, this is the same girl that 24 hours after her first injection was diagnosed with sudden onset rheumatoid arthritis. So, we went through everything and eliminated all the options and called all kinds of experts and came down to the fact that HPV in your blood does not stay there for more than 48 hours, natural HPV. So this had to be something different. So we asked Dr. Lee if he could test a vial of Gardasil, and after much discussion, he agreed to do that for us. And another rabbit hole, Gardasil does indeed have viral DNA fragments in it. So we tested more samples, and we got samples from all over the world, different manufacturing facilities. 100% of the samples that he tested for us were contaminated with viral DNA. We immediately informed the FDA, and they all got together and decided that we knew it all along. It's a part of the manufacturing process. It's expected to be there. Well, that's definitely contrary to what they all said. A year later, he discovered that this viral DNA fragments that were in the vaccine were also firmly attached to the aluminum adjuvant. Now, that in itself creates a new chemical compound of unknown toxicity, never been tested, and that's in the Gardasil vaccine. A few months after that, he discovered that not only was the viral DNA there, and it was firmly attached to the aluminum adjuvant, but it had also adopted a non-B conformation. Now, that's all Greek to most people, but basically what it means is the ends of the protein fragments have mutated so that they don't attach normally, they attach like super glue. So we're injecting this, it goes through the lymphatic system, we don't know where it ends up, we don't know what the consequences are. He testified in a coroner's inquest in New Zealand as to the fact that this very well could have caused one girl's death that he's aware of, that he has actually examined the tissue. He found that contaminant in her blood and spleen tissues. Now, another lab also found at the same time, same girl, same coroner's inquest, the antigen used in Gardasil in the brain and spinal column of the same girl. So at this coroner's inquest, two biologically plausible mechanisms of action were presented to no avail. The ultimate decision was the cause of death is unknown.
Wow.
And we're injecting this stuff into our bodies.
And nor is anyone, well, some people are investigating, but certainly not national health authorities, certainly not Merck, certainly not GlaxoSmithKline. Independent scientists are working on it to see if they can actually pin down this mechanism of action, but one would think that would be the FDA CDC's job to order that kind of investigation.
Yeah.
Yeah. Norma?
We've got about 5 minutes left in this show, so
do. Wow.
let's. Yeah, I know. What would you like to say? and
Well, I
who would
wanted
you
to
like-
ask Norma, you brought up the work of Dr. Lee, and is it not the case that he brought his findings to the attention of the World Health Organization as well?
Yes, he did. In fact, he brought to the attention of the World Health Organization that there was a concerted effort to bury that information, discredit him, and he has got, via Freedom of Information, it's called something different in New Zealand, but someone, in New Zealand submitted a Freedom of Information Act and got all sorts of emails from World Health Organization people, scientific experts, the Global Advisory Committee on Vaccine Safety, all colluding with each other to figure out how to minimize the impact of his findings.
Wow.
And what did the World Health Organization do with that information?
There has been absolutely no reply to his open letter, and he also submitted it directly to the World Health Organization. There's been absolutely no reply from them and it was submitted
doesn't surprise me.
January
That's an
14th, I
important
believe,
question.
I know, I was saying the same thing.
January 14th of this year, 2016?
this year.
I have a question here that I think is very important for all of you can answer this. Is the pharmaceutical industry treated like other defendants in personal injury lawsuits in the United States? Who wants to answer that question? Norma? Who wants to answer that
Absolutely
question?
not.
Susie?
Are
Well,
they?
with vaccine manufacturers, they don't even get into personal injury litigation
They
because
don't.
they're immune from prosecution on their vaccines.
Pharmaceutical companies are
Other-
immune.
Right. In this country, what you do is you bring a claim to the United States Court of Federal Claims, and the defendant is the Department of Health and Human Services. They are the respondent, and they are represented by a attorney from the Department of Justice. And this was created, again, under this legislation in 1986. They meant to make it easy, fast. It was meant to be an administrative proceeding because of the costly litigation regarding the DTP vaccine. But over time, what people have found is that this court is litigious, it's not generous, it's not quick and easy. There are claims for HPV vaccine injuries. A lot of them are autoimmune conditions. Right now, a lot of teenagers with POTS, which is postural orthostatic tachycardia syndrome, and there are, you can get compensation. The big issue is the statute of limitations. It's generally
They must
3
drag it out
years.
too, yeah.
So a lot of people don't make the connection between getting the Gardasil, whether it's the first shot, the second shot, or the third shot, or whichever HPV vaccine, and then getting a vaccine injury. But in other countries, there is a lot of litigation because the pharmaceutical industry doesn't have the extreme liability protection. And Norma can maybe quickly sort of tell us what's happening in other countries regarding this vaccine.
Oh, sure. In India, there's a case in the Supreme Court regarding clinical trials that were conducted in India. No informed consent, human rights violations, lack of care for those that were injured, et cetera, et cetera. They're trying to actually ban HPV vaccines. Japan has rescinded the government recommendation. There's currently lawsuits being filed against not only the manufacturers, but the government agencies involved in approving and administering the vaccine. They're suing for damages and lack of informed consent, and they're going to put those cases in 4 different, we would call them states, but they're 4 different cities in Japan are going to file simultaneously on behalf of the injured. In Colombia, there's lots of cases that have been awarded guardianships. The girls are being appointed guardians to guarantee that they get any medical treatment they need, any tests that they need, and the state has to pay for it. Colombia, Mexico, and Spain are trying to get the HPV vaccines before an international court, crimes against humanity. Just yesterday, a 26-year-old paralyzed Gardasil survivor in Costa Rica filed a one-of-a-kind suit. She is suing Costa Rica's Ministry of Health for approving and authorizing the use of Gardasil despite knowing significant risk of severe damage, including paraplegia. She took 1 Gardasil injection, and 24 hours later, her body shut down and quit working. She is still, 2 years later, in a wheelchair.
Wow.
Well,
Can I just
So
add?
he's suing the health department.
Yeah.
really quick, we've got a few minutes.
As an attorney, this is just a disclaimer. This is not legal advice. This is just really information that we feel it's important for people to know so that they can make informed decisions about what to put in their bodies or in their families' bodies.
Right, exactly. That's true. That's what it's all about. Unfortunately, we have to stop now. I mean, I'm sure we could talk about this. So many more questions. There's so many more things to talk about. But we want to give the contact information. To get in touch with Dr.
Can I say
Sensenig.
just one thing? When you cannot trust the health authorities, you must become the authority.
Right.
Do your research.
Okay. To get in touch with Dr. Sensenig, you can. His phone number is 203-230-2200, and he has a website, www.naturalhealthconnecticut.com. He's here in Hamden. To get in touch with Susan Lee, attorney, she's at www.knowyourvaccines.com. Her phone number is 203-517-8615. Her email is susan@vaccinearticle.com.
Nothing for Norma?
No, it's not up there for her.
Okay.
Yeah, Norma has a fantastic website, SaneVax. Check it out. She has a
Okay.
load of information about the HPV vaccine.
SaneVax.com?
SaneVax.com.
Probably ought to spell that.
.org.
SaneVax.org, SaneVax.org. Go and find out some information. Take charge of your health. Don't ask questions as to why someone wants to give you a medical professional wants to give you medication. Don't just take it because they're telling you you should.
All right. You know how to get in touch with us. So we're going to say good night now. We're going to thank you so much for coming. It was wonderful.
you.
Thank you,
Thank
Dr.
you.
Sensenig.
Thank you.
Thank you both.
so
My
much.
pleasure.
Good night now.
The river wash the journey from your hand. Feel the comfort flow inside you. Come this far